I'm Dr. Shannon Harker. I'm a pediatrician at Grand Itasca. I think we all need to be concerned about how much screen time we're using, both as children and adults. General recommendations are for children under the age of 2 to get less than an hour or 2 of screen time per day. And that generally means using FaceTime or some educational application, and then really monitoring use. Digital media does have some negative effects. We know that it affects sleep, increase in depression and obesity rates, also exposure to unsafe content. Cyberbullying is also a huge concern that we all share with digital media and our kids. I think keeping children safe when using digital media is extremely important. I think, first of all, having conversations with your older children about what apps they're using, what types of things they're posting, and then monitoring those apps and those posts to make sure they are using it appropriately. I think being upfront and honest as parents and having this conversation before they get a digital device of their own. For example, asking them what they think is appropriate use. What do they think are appropriate things to post, and what would they be concerned about? Digital media has great positive effects as well. We know that we can do a lot of online learning and education through digital media. We can find out news and information. We can make social contacts that may have been more difficult without social media. We can communicate with family members who don't live near us. I think some guidelines to have a healthy relationship with digital media should include making a family plan about wise use. Use your common sense. Have some areas that are digital-free zones. Maybe avoid using digital media at meal times. Having a space where you can charge all of your devices that are separate from bedrooms and in a common space. Avoid using digital media before bed for at least an hour, and that goes for adults and kids. Avoid easy access to screens in children's bedrooms. This is well known to interfere with sleep. I think parents should be able to lead by example with digital screen use. Model the behavior you want to see in your children. To make sure your child isn't using excessive amounts of screen time, have them take breaks. Get outside and play. Do some type of physical activity. Do activities such as puzzles or games. Parents can engage in their children for both those behaviors. Maybe cook together or do some sort of a hands-on activity, especially for younger children. I think the American Academy of Pediatrics message is to the question of when should you get your child a phone? And it really has to be when you think your child is mature enough to handle some discussions about safe use and to monitor their own activity. Consider creating a family media use plan, and this can be found on the American Academy of Pediatrics website, healthychildren.org. Grand Itasca Clinic and Hospital, your partner in health.